Hello, I'm Dr. Dave Behling with Life Restore MD. This is one in a series of videos that I'm creating to educate my patients and people who might be interested in becoming my patients about common questions that they have, to save them a trip to the office, so to speak. The main question I get asked quite frequently by my patients is, how do I know if I have low testosterone? Well, testosterone does many things for both men and women, and there are a number of symptoms that you can identify. They come in two main groups. There's the mental and the physical. The mental are by far the most important, if you ask me. The first is decreased energy. And your energy is a mental factor, not necessarily a physical one, because it's our motivation to accomplish goals. All right. Our testosterone level is directly responsible for the size of our energy pool. As our level drops as we age, for both men and women, that energy pool shrinks. Now, most men will take the strategy of putting their work in the center of that energy pool because, well, that's how we pay our bills and take care of our family. The problem with that strategy is that as that pool shrinks, we lose motivation for things in our life that are important. First, we might lose motivation for our athletics. Then we might lose motivation to work out. Then time with our friends. Then more important things. We might lose meaningful time with our children and even our wife. It can even shrink underneath our work, and our work performance can start to fail. When we replace that testosterone, we refill that pool, not only can we do our work well, but we can add all those things back into our life that make life worth living. That's why I call my clinic Life Restore MD, by the way. The other mental factors are important as well. Decreased libido, that's a desire to be intimate with your partner. All right. Then there's increased rates of depression for men and women who have lower testosterone levels. Now, men typically don't cry in the corner. What we do is we get anxious and angry at things that didn't bother us before. When we replace the testosterone, we get our confidence back. We're more comfortable in our own skin, and we don't sweat the small stuff. The last mental symptom is insomnia. Now, for me, that was the worst one. The guy in this conversation who guaranteed has low testosterone was me. When I checked 6 years ago, my testosterone level was 216. That's a testosterone level of about a 74-year-old man. I was 42. Now, but people with low testosterone sleep very shallowly. We'll wake up to tiny noises that don't bother other people, and then we might spend 20 to 30 minutes trying to get back to sleep. In the morning, you may wake up more tired than when you went to bed if you've woken up 2 to 3 times a night, because you don't get into those deep sleep cycles that really refresh. Now, the physical symptoms of low testosterone are just as important, okay? Decreased strength, decreased endurance, decreased erectile function for men. Men with decreased erectile function due to low testosterone, which is approximately 75 to 90% of all erectile dysfunction, I help them diagnose themselves this way. On a scale of 1 to 10, with 1 floppy like a dish rag, and 10 hard as a rock, and 7 just enough to penetrate your partner, men with erectile dysfunction due solely to low testosterone are generally between a 6 and a 7. They can get a penetrable erection many times, but it won't stay firm enough to be penetrable the whole time if they don't maintain constant focus. All right. If those are your symptoms, after 8 weeks of testosterone replacement, we can get you back to be a 9 to 10 out of 10 every time again. All right. The last physical symptoms are increased recovery time from heavy activity. Men with normal testosterone and women will recover from a heavy work or heavy workout within 12 to 24 hours, so they can get up the next day and do it again. People with lower testosterone might take 2 to 3 days for that same work or workout, and that's how we lose consistency with the workouts and our health declines. The last physical symptom is the inability to grow muscle. Now, if we work out very, very hard over approximately the age of 40 or 45, we can maintain what we have, and I'm talking about heavy resistance training for about an hour every day, but we'll never add lean body mass. When we replace testosterone, if your goal is to add lean body mass, you'll be able to do that after 8 to 10 weeks of therapy. All right. Thank you very much for watching my video. Again, I'm Dr. David Behling with Life Restore MD. I hope you found this video helpful. Again, Life Restore MD. Be your best.